All right, welcome to The Explainer. Today, we're digging into a really popular herbal supplement, saw palmetto. We're going to look at what it might mean for people with multiple sclerosis. So is it real hope, or is it all just hype?
For anyone living with multiple sclerosis, bladder dysfunction is this really tough daily reality. It's not just a small inconvenience, it can seriously impact your entire life. So it's no wonder people are looking everywhere for some relief. And that brings up a big question. Could a natural remedy actually be the answer?
All right, let's dive into the search for relief.
So here's the thing. In multiple sclerosis, this isn't some simple plumbing issue. The disease actually damages the nerves, the very communication lines between your brain and your bladder. And when those signals get scrambled, well, that's when you start dealing with symptoms like urgency and frequency, things that can totally disrupt your day-to-day life.
Okay, so what exactly is this stuff? Saw palmetto comes from a small palm tree. You'll find it in the southeastern United States. And it has a long history. We're talking over a century of its berries being used in traditional remedies, mostly for, you guessed it, urinary issues.
So let's talk about the plant's potential promise. What's the actual theory? How is this little berry supposed to work its magic on the bladder? Well, there are really two main theories here. The first one is that saw palmetto might actually calm the bladder down directly. The idea is that it binds to certain receptors in the bladder, kind of like how some prescription drugs work, to help reduce those unwanted muscle contractions. And second, we know it has anti-inflammatory properties. So in theory, it could help soothe an irritated bladder.
And that theory, it sounds pretty good. It gives us a plausible reason to feel hopeful. But, and this is a big but, a theory is not the same as proof, not even close.
So it's time to start following the evidence trail. Let's see what the actual research has to say.
So what about its most common use? We're talking about prostate health, or BPH. This is really where saw palmetto made its name, and it's where most of the scientific research has been focused. And this is where we see a real tale of two findings. The early studies, they looked really promising. Some even suggested it was just as effective as prescription medications. But as the science got more rigorous, the picture started to look very different. Modern, high-quality reviews, including a huge one from Cochrane in 2023, they found that there's little to no difference between saw palmetto and a sugar pill. So why the conflicting results? Well, this highlights a massive issue with supplements in general: a lack of regulation. The amount and quality of the active ingredient in saw palmetto can be all over the map from one brand to the next. That makes it super hard for scientists to get consistent results.
Okay, so for the prostate stuff, the evidence is pretty shaky. But here's a twist. Remember that other theory? The one about saw palmetto acting directly on the bladder itself, not just on the prostate? Well, what about that? And this is where we get a real glimmer of hope. A 2022 study, a really high-quality one, randomized and placebo-controlled, the gold standard, looked at women with overactive bladder. And what they found was that saw palmetto significantly reduced how often they had to go during the day and at night. Honestly, this is the strongest clinical evidence we have so far for a direct effect on the bladder.
Which brings us to the critical missing link. This is the whole reason we're doing this explainer. Okay, we've got a promising theory. We've got one hopeful study for overactive bladder, but what about MS? What's the evidence for MS-related bladder symptoms? The number of clinical trials that have studied saw palmetto for bladder symptoms, specifically in people with MS, is 0. A big, fat 0. No clinical trials, no case studies, nothing. There is simply no direct research. And look, this matters a lot. Why? Because the bladder problem in MS is neurological. It's coming from nerve damage. That is fundamentally different from what's happening in many other bladder conditions. You can't just assume that what works for one will work for the other. A good theory is simply not a substitute for hard evidence in a condition as specific as MS.
Okay, so now that we've covered the effectiveness part, or lack thereof, we have to pivot to some serious warnings and reality checks. We have to talk about safety.
And this is super important. Natural does not always mean safe. Saw palmetto can have some really critical drug interactions. For example, it might increase the risk of bleeding if you're taking any kind of blood thinner. We're talking about warfarin, Plavix, even just daily aspirin. It can also mess with hormonal drugs like birth control or hormone therapy, possibly making them less effective. These are not small risks.
And listen to this quote from the American Urological Association. They say, use of these supplements without a medical diagnosis could dangerously delay treatment for life-threatening conditions like prostate or bladder cancer. Think about that. Trying to solve the problem yourself could mean you're missing the real cause, and that delay could be incredibly dangerous.
All right, so after going down this whole rabbit hole, from the promising theories to the hard evidence, what's the verdict on saw palmetto? Let's just break it all down. We started with a hopeful theory, and yeah, the science behind it is plausible. But the evidence? It's conflicting. For prostate health, modern studies say it's a no-go. For overactive bladder, there's a little glimmer of hope. But the critical missing link, there is zero direct evidence for MS. Add to that the very real risks, drug interactions, lack of regulation, and the bottom line becomes pretty clear. This is not recommended without medical guidance. But here's the good news. The whole point of this explainer isn't to just shut down hope. Not at all. It's about channeling that hope toward treatments that are actually proven to work. And there are a lot of evidence-based options to discuss with your doctor, and there are so many proven paths to relief. We're talking about things that range from lifestyle and behavioral changes all the way to really effective medications like antimuscarinics or beta-3 agonists. And for some people, even things like Botox injections in the bladder or nerve stimulation can be game changers. These are the real evidence-backed conversations to have with your doctor. So it all comes back to this one big question. When hope and science collide, how do we find our best path forward? You know, that search for answers is totally human, especially when you're managing something like MS. But the best path, the safest path, is always going to be the one where we team up with experts, trust the evidence, and focus on what's been proven to truly help.